Welcome to Treasure Coast Community Health, with 7 locations to serve you better. We have a dedicated staff. And now, here's your host, CEO Vicki Soule.
Well, hello there. This is Vicki Soule from Treasure Coast Community Health. The announcement is true to form. At Treasure Coast Community Health, we do provide a number of different services: medical, dental, behavioral health, and lately the joke has been, and a fourth service line called COVID. That's just because we're so happy and proud to be able to bring these services to our community. Not that we have forgotten the importance of good preventative and chronic care for our patients, but there are so many out there that are concerned about the COVID virus and how we can permanently erase it from our county, if not our state. So today I've asked our Director of Operations, Steve Hellyer, who really was the originator of this whole event outside of our 8 different health centers, to help the community understand some of the timely topics, the questions that we get, some of the answers we provide, because we recognize that not everyone has gone through. Some of our nurses have added into those frequently asked questions, which I will then give him. And hopefully you'll find this timely and informative. So, Steve.
Vicki, how are you?
Well, honestly, it's unusual to see you in the same room as myself, because most of the time you are out at one of our events. Now, we started with COVID testing close to 6, 8, 10 months ago.
Wow, that
forever,
was,
right?
April.
Yeah,
beginning of April last year.
Wow, so
it's been nonstop.
It has been. So we've had ups and downs in the volumes. So tell us where we're at now in terms of what times you're providing and where you're providing testing opportunities.
So right now we're doing our testing 2 days a week. We're doing it at the Intergenerational Center off of Oslo, and we're doing them from 8 to 10 on Wednesday mornings, and we're doing them from 2 to 4 on Friday afternoons, trying to get a little bit different time frames for people to make it as convenient as possible.
Now, they don't have to make appointments for that.
No, not for the testing. The testing is first come, first serve. Okay. We've been seeing anywhere between 50 and 100 people per day, which is down considerably from the peak when we were doing 500 to 600 per day. Mm-hmm. So it's a little bit of a break, but we're seeing a lot of the same people, a lot of healthcare providers that are coming in just to confirm with for their employers that they remain COVID free. And
those are PCR tests, not rapid tests.
Yeah, those are the PCR tests. Now we do have some availability of rapid tests, but right now everybody they're about worth their weight in gold. Everybody's having trouble getting their hands on them. So
who are those held aside for if we get those?
Those are for kids that are sent home from school with symptoms.
Okay.
Teachers that have symptoms, first responders, doctors, nurses.
So if they have symptoms, it's a way to differentiate between COVID and the flu, or COVID and anything else.
Yeah, a lot of the symptoms are the same, but the reason we're doing the symptoms, because if a kid is sent home from school with symptoms and they end up being COVID negative, they can return right back to school.
Oh.
If they're sent home for school with exposure, we don't test those rapid because they're going to be home for 10 to 14 days. Anyway, yeah, there's no getting back earlier from the exposures.
Okay. The exposures in the community seem to be going down, but I noticed that there was one principal who gained notoriety because of an exposure and a quarantine.
Yeah, the exposures are definitely going down. The numbers are going down, both with people that are infected, I don't want to say infected, but people that have it. The emergency room visits are down. The ICU usage is down. So we're definitely trending in the right way.
Absolutely.
And that could be, because we're starting to get some more immunity in the community. People wearing masks, they're socially distancing. People are being smart. We're seeing a lot of people that are being diligent in what they're doing to protect themselves and to protect others.
Now, a lot of folks are not wearing masks, particularly if you go outside. I was over at Humiston Park this weekend, and of course it is outside, but when you get right up next to a painting and the artist comes up next to you and says, "Do you like it?" They had masks on, but a lot of the public did not. Do you think that's because, as you said, more people are getting the vaccine and they think, therefore, we're good to go? We don't need to wear a mask?
I think that's part of it. I think part of it, too, is when you're outside, especially with the breeze, we've had a lot of wind and they're not sure about the transmission outside. But I mean, generally, if you're within 6 feet, if you're walking around without a mask and somebody comes up to you to talk, pull your mask up. Just do what you can to try to prevent it. Who knows?
Yeah. Well, the reality is that while we're all thrilled that the 2 vaccines that are out, Pfizer and Moderna, are 95% effective based on huge studies prior to giving out the vaccination, there's still that 5%. That means 5 out of every 100 people that gets a vaccine is probably not as protected as they think they are, because it's not like you can put 1, 2, 3, 4, 5 on the forehead for the last 5 that got it. It's kind of a random selection genetically and according to other factors that we don't know about.
Correct.
So that's the importance of still wearing the mask until we really have this gone.
Yeah.
Okay.
Yeah. It's just about just being smart about it, being smart about what you're doing.
Continuing to wash your hands.
Absolutely. It's just the basic precautions. Wash your hands. I mean, honestly, I don't really like people being that close to me. So, I mean, if, just keep your distance and mind your business. I'm not saying isolate and don't see anybody, but just be smart about what you do.
Go out when you have to and don't go into crowds if you don't have to and those types of things.
Exactly. Just be smart about what you do.
Okay. So tell us about the COVID vaccination project. We've been doing that since January 2nd.
Yep.
And how many do you think you've done in that 2-month period?
Oh, wow.
Out on the sites?
We're up over, I'd say we're well over 5,000 already. We've got it worked out to where we can get about 80 people through an hour in their vehicles. We bring them in through one stop. There's 4 stops along the way. And we just keep it going like an assembly line.
You could do this in your sleep, couldn't you?
Yeah. And, we're really proud of what we've been able to do. We've had a lot of good compliments on it. And as always, we're trying to get better. We're trying to do things smoother and more efficiently. Nobody wants to sit in their car for an hour to get a vaccine, but unfortunately, that's how it is. So, I walk up and down the lines to say hi and talk to people. The staff has done a tremendous job. Even I know they're tired. I know they're worn out. They've always got a smile on their face, start to finish.
And we've added volunteers to that group as well.
Yeah, we've got a great group of volunteers, and they've done such a wonderful job. It's allowed us to have our staff where they don't have to be at all these, and our volunteer staff has done a tremendous job of supplementing.
Yeah, we're very grateful for that, without a doubt.
Great. Yep.
So the 4 stops, let's go back to that for someone who hasn't gone through the line, the vaccine line. Wasn't there a dance line that, you
conga line.
The conga line, in cars.
Yeah, we got a car conga line. Yep.
So what's the first stop?
So what we do is we start out with scheduling 20 people every 15 minutes.
And we'll come back to that scheduling process.
They'll come in through one area. They'll stop at the first tent. That's where they get checked in. That's where they'll show their ID. They'll show their appointment. And we check them off a list. We'll continue them around, and they'll get their paperwork there. They'll fill out their paperwork in their car as they continue. And the paperwork is? It's a consent form that's required from the state.
Okay.
And it's also a 6-page information sheet on the vaccine that they're getting.
They don't have to read it right there.
No. They don't have to read it right there. It's too long to read right there.
Okay.
So then they'll go to the next tent is where they'll stop. And we have our volunteers there, and they help if somebody needs help filling out the paperwork, if they forgot their glasses, whatever it is. We help them fill it out.
Okay.
And then we send them ahead to the next stop, which is where they actually get their vaccine. When they get to that, our nurses will look at the form. They'll screen it. They'll make sure of any medical issues that they have.
So they may ask questions.
Yep. They're going to ask some questions, ask if they're allergic to anything. And then what they'll do is they'll give them their shot. They'll go to the final stop where they'll sit for 15 minutes or 30 minutes, depending on what kind of medical conditions they have.
Okay.
And then there's a nurse in that area. They watch them. They take care of them. If somebody does have a reaction, which, knock on wood, we haven't seen yet, we have fire rescue that's there. So it's quite a process. Start to finish is between 45 minutes and an hour.
Okay. Sometimes I've heard a little bit faster than that, and on a rare occasion a little bit slower.
A little bit.
What kind of occasion will slow the line down?
It could be anything. It could be somebody that's having, that has a little bit more extensive medical history that we have to look at. Okay. It could be one of our nurses had to use the restroom. It could be that, we stop everything for 5 minutes just to let everybody grab a bite to eat on our longer days real quick.
How about people coming in early for their appointments?
Oh, yes. People, we tell everybody to come in right at your appointment time. Because when people come in early, then the check-in staff has to look through several pages to find that time frame, and it backs it up a little bit. So we really encourage everybody to come in right at their appointment time.
Okay. So let's talk about the appointment process itself when we come back from a station break.
All right. Sounds good.
Hi, I'm Vicki Soule, CEO of Treasure Coast Community Health. Treasure Coast Community Health has been serving Indian River County for 25 years. How did we get here? It took a commitment to you to provide you with the most affordable, high-quality, integrated network of healthcare available anywhere. It took board-certified doctors and dentists and a dedicated staff to ensure that you receive the best possible care. It took more locations to meet the need, and now TCCH has 7 locations, with the latest one conveniently located down the street from Cleveland Clinic Indian River Hospital. Our services are available to everyone, whether insured or not. And at TCCH, no one gets turned away due to an inability to pay. We rely on donations from generous benefactors to continue our much-needed work. We accept Medicare, Medicaid, and almost all insurances. Call us at 772-257-8224 or visit us at tcchinc.org.
Stop. Don't make a $1,000, $5,000, or $10,000 mistake. Remember the name, Atlantic Hardscapes. Atlantic Hardscapes has the best prices for all your hardscape needs. From pottery fountains, synthetic turf, pavers, rock, topsoil fill, boulders, flagstone, outdoor kitchens, and much more. Delivery and installation is available. Their beautiful outdoor showroom is next to Pineapple Joe's in Fort Pierce. Remember their website, AtlanticHardscapesSupply.com.
The Bottle Shop. Liquor, wine from France, Italy, Spain, and California. They even do deliveries and parties. Are you planning an event? Bottle Shop provides liquor and wine on consignment. Pay for the booze you use. They deliver anywhere on the island. Hotel rooms, too. The Bottle Shop, next to the Boiler Bar, both on Ocean Drive in Vero Beach. The Bottle Shop, 772-231-0277.
Is owning a home your goal? With the rising cost of rent, you could be saving a lot of money by owning your own home. At Caliber Home Loans, we can help make homeownership a reality. Meet with us for a free consultation and get on the right path to buy the home of your dreams. For Caliber, home loans is all we do. We use local appraisers and offer a variety of loan options to fit your lifestyle and budget. Call us today, 844-GO-CALIBER, license number CHL15622, CaliberHomeLoansTreasureCoast.com.
And welcome back to Community Conversations. This is Vicki Soule, the CEO. That is a blooper for you. I'm talking today with Steve Hellyer, also from our organization, about COVID. We get so many questions and so much misinformation is out there. We thought it would be helpful to kind of straighten the record up, at least as it pertains to Indian River County, Treasure Coast Community Health, and right now, because the one thing we can count on is give us half a day and things are going to be different.
Correct.
But we get a lot of common questions, and so we thought it would be helpful to kind of review some of that. Steve earlier talked about how we're still doing testing. The rate is going down. The number of people that are positive is going down, as well as the number of people that are testing as a percentage of the whole. But we're still doing that on Wednesday.
Mm-hmm.
Tell us again.
Wednesday from 8 to 10 at the IG Center.
Okay.
When you come, enter off of 20th Avenue Southwest at Richard Byrd Park, South County Park. For everybody that doesn't know, it's 800 20th Avenue Southwest. You'll enter there, and you'll follow the Shell Road around to the right under the tents.
Okay.
Very easy to find.
And Friday afternoon for those that are not available in the mornings?
Friday, 2 to 4.
Okay.
Yep.
And no appointments necessary?
No appointment necessary. Come as you are.
Okay.
First come, first serve.
Okay. Nice and easy. And that's the way we wish this could be with the COVID vaccines. But of course, it's gotten very complicated very quickly. But we're going to try to demystify some of it. You've talked about how we are scheduling those appointments. Tell us about how that process works.
Okay.
Are we doing it all ourselves? Do we have community partners? How do we have a special list, an A list of VIPs?
No, we do not have a special list. So let's dispel that one right off the gate.
Healthcare for all.
Healthcare for all. That's
Okay.
our motto.
Okay.
So what we've done is we've actually partnered up with a lot of people in the community. Most notably, and who's carried a lot of the work is Freddie Woolfork from the GYAC in the Gifford community. He's done a great job. And what he does is we'll give him blocks. We'll give him
9 o'clock to 10 o'clock.
9 o'clock to 10 o'clock. We'll give him 80 slots. What he does is he'll fill them, he'll assign those times, and then he'll send it back to us to put on our master roster. And that helps us with our manpower that we can do other things while he's filling those. And Freddie's got great reach in the community, and it's him, it's Alma May, and several other people in the community.
He's got a real team going. Okay.
And they work very hard to fill it.
But it's not just about the Gifford people. We've had others that have helped us with group events. St. Francis Manor, Bonnie, that's over there, was a big help. Karen Deagle at Senior Resource Association.
Yes, Senior Resource has been great. They've actually provided a lot of transport for the people that just don't have another way to get down there. And when they send their buses through, we actually pull the buses through the tents, go right on the bus, and we do the vaccines right on the bus for them. Trying to help out as much as possible.
So it's just as convenient as owning your own car.
Absolutely it is.
Only you get to ride with your friends.
Absolutely. Yep.
And Peggy Falsgraf over at Alzheimer and Parkinson's also set up a number of folks.
Yes.
So we appreciate that community support. But then if they're all coming as a group, why do they get assigned a time?
Because everything is allocated. We have to know ahead of time how many we have. So what we do is we schedule them out, like I said, 80 per hour. Okay. Because we have to know how many we're going to do in that 6 or 8 hour period, because we have to figure out at that point, okay, we need this many doses, and the doses are very difficult to come by. We don't know sometimes until the day before what we're going to be allocated for doses. And that's just because nationwide it's in short supply.
Okay. So if those folks are allocated a time and they can't make it, what does that do to your scheduling? For your repeat doses, your number twos.
It throws it off, but we have a couple days leeway in order to get people back in if they can't make it back for their second dose. Okay. So just because you can't make it back for your second dose on the day doesn't mean you're out of luck. It just means we're going to have to bump you ahead a day or behind a day. But we're still working really hard to make sure everybody gets their second dose. Now,
Pfizer repeats in 21 days, and I've heard from the nurses we can't push them back to 19 or 20 days. They would push up.
Yes, and actually, from what our director of pharmacy was saying, is Pfizer's actually looking at pushing it out to a 30-day repeat, but we're just not sure yet. Okay. And there's a lot of things that are just, they're still up in the air, and they're still learning, they're still reaching.
Absolutely.
But they want to make sure that they do it right, and they want to make sure that they're providing the best product for the people.
Wow. So what kind of questions are you getting as people are making appointments or coming through on their first or second shots?
A lot of what we get is, what are the side effects going to be? People have heard side effects from an itchy arm to immediate death. I can promise you there's no immediate death. We have not seen it.
No.
But, there's a lot of misinformation in the media.
If it bleeds, it sells or something like that.
Yeah. Nobody wants to waste a good crisis, so it makes headlines. Yeah. But what we're seeing is some redness maybe at the shot site, and with that you can use a cold compress. You can massage it a little bit. Some people are reporting flu-like symptoms, which happens with the flu vaccine.
It is related. It is a virus that's very closely related to the flu.
I mean, you're going to see little stuff like that. We've not seen anything, pressing out of the ordinary. That's, I think the worst thing we've seen, when I got mine, I was sick for a day.
Okay. You felt ucky. You stayed home.
Yeah.
You slept.
Had a little bit of a fever. I slept for some time. It's to be expected.
Some people have reported headaches.
Yeah, headaches. A little bit of
ibuprofen makes that go away.
Yeah, use a little bit of ibuprofen. It's just standard when you get a vaccine, same as when you get your flu vaccine.
Okay.
And people are gonna, it's gonna happen.
Yeah, and we're particularly comfortable now and aware of people with cancer or other immunocompromised situations. I know that they get warned and warned and warned. If you're taking chemo, stay away from, things that you don't normally encounter, and they put vaccines in that same bucket. But we've had absolutely no problems with that.
And we've had quite a few people come through that are battling cancer, that have had it. As a matter of fact, my dad just got through battling cancer, and he won. Awesome. Yay. And he got his Friday. So it's just one of those things that, talk to your doctor if you're concerned. By all means, reach out to your doctor. That's what they're there for. And the doctors have been great.
Okay. And they're going to have another opportunity to be great, as we are, since the governor just released his new executive order modifying the first one that said over 65 only. Now we can give out vaccines to people under 65 with doctor's notes, meaning they fit the criteria for excessive chronic types of medical conditions. All we need now is vaccines, right?
Yeah. So
by the time this airs, hopefully we'll have fixed that.
So the big thing with that is if you come to one of the drive-thrus and you have the doctor's note, bring us a copy. We have to have it that we can staple to the consent form. Otherwise, we can't do it. We have to have a copy for us. So got to make sure if you come through, make sure you bring one. Okay.
And a mask, even though you're 75% protected from the first one. We're still wearing masks to protect our staff and our volunteers and you.
Yep.
Okay.
Wear your mask.
Because again, the 5% factor, we don't know who has got a little weaker response than those studies.
Correct.
People. Okay.
Yep.
Good news is Johnson & Johnson appears to have been approved, and so we're hopeful that some of the folks that are hard to track down for number 2s will be able to get the number 1s. And
they
we
got
can
their
take care
EUA,
of them.
I believe, on Friday.
Yeah, so we're looking forward to being able to participate in that. But again, it's a nationwide shortage, regardless of what you see in the newspaper. It is a day-to-day situation.
Yeah, we don't know. We'll know maybe if we're lucky, we get a day. We'll know a day ahead.
Yeah, so kudos out to everyone who's been so cooperative and understanding of that. I know we jotted a couple of notes before we came here. And one of the things, as we're talking about the number 2s that come up, is people wanting to have their number 2 to fit around their schedule instead of the assigned 21, 28, or 29 days scheduling. What does that do? I can understand why they want to. Maybe if Publix calls them and says, well, we can take care of you, and they've had a number 1 from us. Isn't that okay? Doesn't that give us more vaccine to give other people?
Nope. It is across the nation. It is, you have to get your second dose where you get your first.
Same type, same
place, same provider.
And why is that?
And that's because of the allocations. Everything's measured out nationwide. Everything is allocated for each person to get 2 doses. So when somebody doesn't show up or they want to do it on a different day, it really throws a monkey wrench in things. And that actually causes more waste than if somebody went from Publix to us and then they, oh, well, you could use it for somebody else. Well, no, we can't, because that throws the scheduling off. So it's super important.
We didn't get a number 1 allocation for the same person.
Yes.
Okay.
Yeah.
And so is there reporting back to the state?
For that, yes, we report every vaccine clinic we do. Within 24 hours, we have to upload the whole shot roster to the state, and the state actually tracks it through Florida Shots, the first and second doses.
Okay, is it just their names that the state is tracking?
No, it's their name, their birthday, their phone number,
the
their
entire
address.
Consent form.
Correct.
Race, nationality.
Yes, and
everything.
It's really important to get out. What is your race? What is your nationality, ethnicity? Because they track that, because they want to make sure so we can track
no
and see.
Populations.
Correct, that nobody gets lost in the shuffle. And it's equal across the board for the vaccine distribution. Okay.
Is there anything else that we've learned that you want to share in our 1 minute remaining?
Yep, I forgot that Jesse Zermano out at Operation Hope has been a gracious host to us.
He has been.
He's given us use of his property to do vaccines, and he is another one that is helping to fill the schedules. He's done a great job.
County has loaned us their properties.
Yes, and Indian River County, Kevin Kerwin, Mike Redstone, Jason Brown, Tad Stone, the fire chief. They've all just worked so well with us, made sure we have fire rescue, make sure we have property to do our sites. It's been a fantastic community partnership. And
we forgot the most important one. Miranda Hawker, the Department of Health.
Can't forget Miranda. No, Miranda's been great.
Yeah.
She is worked right along with us, and it's been great working with her.
Yeah. So thank you so much for clearing the air on a number of the vaccines today.
Absolutely.
Hopefully we will continue getting new questions and be able to answer them as well. There is no stupid question, only worried people.
Yep.
And I have to say that we've survived almost a year of this. And so just because the vaccines are available, remember the rates are going down, okay? Be patient, be kind. Don't be demanding of the people that are trying to do the right thing. We're peeling them out just as fast as we can. And we know that you're concerned. We really, really do. but we're only able to move as fast as we can move. So we will all get vaccinated, I promise you. Thanks again, Steve, for being here. Okay. See you next week.